Welcome to our multimedia presentation.
In ancient history, transplants were merely a myth involving the intercession of divine creatures, using cadavers or animal flesh. However, by approximately 800 BC, there was some indication that Indian doctors were performing primitive skin grafts. In the 16th century, Italian surgeon Gasparo Tagliacozzi reconstructed noses and ears of patients from the patient's own arm skin. He noticed that the donor skin from cadavers or animals usually caused the procedure to fail and led to infection due to rejection. The early 19th century ushered in what we currently understand of nursing today. Florence Nightingale revolutionized sanitary practices and the scope of nursing to serve all patients, including those of this experimental procedure. The sanitary practices introduced by Nightingale were essential in creating this procedure. About 50 years later, in the early 1900s, European doctors unsuccessfully attempted to save patients dying of renal failure through transplanting of animal organs, attended by the nurses that came before us. In 1905, the world's first corneal transplant was the first successful transplant that we are aware of in modern medicine. Over the next 114 years, surgeons, clinicians, and nurses have made critical developments to the field of transplant operations that have led to today's transplants that are advanced, safe, and an effective part of medical care.
To define transplant nurses facilitate donors and patients who undergo transplant surgery. They provide care and prepare patients and organ donor before the procedure. They educate them about the risks, assist surgeons during surgery, and educate patients on how to recover at home after.
In this presentation, we will learn what transplant nurses do, the important role they play in the medical settings, and how to become one. There are some required education and experience to become a transplant nurse. To become a transplant nurse, you'll first need to earn a nursing degree such as the Bachelor's of Science in Nursing degree, and then pass the NCLEX exams. The standardized exams are required to begin entry-level nursing careers. During your course of study, you may choose to gain experience in the areas of critical care or medical surgical care. Some employers may require an advanced nursing degree, such as the Master's of Science in Nursing degree. After earning your degree, you'll need to get some work experience under your belt and then pass a transplant nurse certification exam. The American Board for Transplant Certification offers 4 different certification exams, depending on specialty. These areas include Certified Procurement Transplant Coordinator, Certified Clinical Transplant Coordinator, Certified Clinical Transplant Nurse, and Certified Transplant Preservationist. Transplant nursing is a specialized field, thanks in part to advances in transplantation and transplant patient care, so you'll likely need to take continuing education classes to maintain your certifications. The average salary for transplant nurses is about $78,000. However, transplant nursing salaries can vary depending on the region in which you work, your level of education and experience, and the setting in which you work. However, the median annual transplant nurse salary in the United States is $77,000 according to 2016 pay scale data.
For the roles of transplant nurses, to prepare patients before surgery, transplant nurses assess the patient's medical history and make sure that he or she is healthy before analyzing the lab results for an organ match. If everything is in order, the nurse then informs them about the procedure and the risks. Transplant nurse also assists surgeons by preparing and checking instruments, ensure if it's sterilized, and monitor patients' vital signs. After the procedure, transplant nurse from time to time will monitor organ recipient for any complications and infections if ever the body rejects the organ. They will administer medications and address wounds and educate patients how to recover at home. The transplant nurse is important because they have the most one-on-one contact with patients than any other health professionals, may it be before or after the transplant surgery. They provide comfort for patients and donors before the procedure and see to it that everything is in order. They simply make it easier for patients and family members to cope, for they make sure that everything you need to be better and healthy is attended.
Now that you have learned about what transplant nurses do, their impact, and how to become one, we hope that you consider this very specialized nursing position in your job search. Transplant nurses are the guardians of a new life for transplant patients and usher them into their new life with education, compassion, and understanding.